My name is Dr. Uduak Ikpegbu. I am a consultant chemical pathologist in General Hospital in Lagos. And I started my nursery school in Papa and then Jenny Jones Nursery School. My primary school was Common Children's School in Chemical Cantonment. And my secondary school was Command Secondary School in Paja, in University of Calabar. My postgraduate was, my master's was in clinical pathology in LUT, the University of Lagos, but the course was taken in College of Medicine, and my residency program was in Lagos University Teaching Hospital, LASUS. And I'm working here as a consultant.
Can you tell us about pathology?
Pathology is a wonderful branch of medicine. In fact, pathology is the bedrock of medicine because it teaches you about what is wrong with the patient, any illness at all. It tells you about the pathophysiology of the illness and actually brings out the cause of the disease. In summary, in a layman's term, the pathologist is a physician of the physician, to the doctor's doctor. The pathologist is the one that will confirm your diagnosis, your suspicions, and make it come alive, that this is actually what is wrong with your patient. Sometimes the doctor may be thinking about having a certain tentative diagnosis, but by the time he sends blood samples, urine samples, biopsies, to the pathologist, the results comes out, it may be something different from what he was thinking about. And so the pathologist is the physician's physician. Actually, there are 4 arms of pathology. We have the histopathologist, we have the hematologist, we have the clinical microbiologist, and then we have the chemical pathologist. I am a chemical pathologist. To become a chemical pathologist, you need to be a medical doctor in the first place, and you go ahead to do your residency program in pathology.
So what are the most common diseases or conditions that you get to encounter on a daily or regular basis?
Yeah, we encounter people with obesity, with hypertension, diabetes, pre-diabetes, and thyroid disorder with obesity. And sometimes you also see neonates with neonatal maybe carbohydrate metabolic disorders, so sometimes see patients like that, but the common ones are the obese patients with postural complications of obesity, which include osteoarthritis, insulin resistant diabetes mellitus, hypertension, and sometimes they may be related to thyroid disorders.
So how easy is it to get an appointment with a chemical pathologist?
To get an appointment with a chemical pathologist, you need to be referred to the specialist clinic, and you need to have seen your general practitioner or any other doctor that is managing you, and then you need to be referred based on certain criteria, like if you're hypertensive, diabetic, and obese, and maybe complicated with thyroid disorders or any metabolic disorders, you can be referred to the metabolic clinic or the well woman clinic. Postmenopausal women, come down with other conditions that are peculiar to postmenopausal women, or children on the ward, who babies who they're suspecting inborn error of metabolism, the chemical pathologist can be called. Also in the ward, either surgical, medical, ONG, any other department, if they have electrolyte derangements in patients, they call in the chemical pathologist.
So, what advice would you give someone considering a career in chemical pathology?
I would like to advise someone going for chemical pathology that chemical pathology is a very wide and broad aspect of pathology, very interesting. Most people think chemical pathology or clinical pathology or biochemical pathology or biochemistry, clinical biochemistry, some people call it clinical biochemistry, is complex. But actually, it is not as complex as people view it. It's actually the chemistry of the body, and it's very interesting.
Okay, so on a daily or a weekly basis, how often do you get patients, like total number of patients that come in?
In a day, we may have over 150 patients that we attend to. Then for immunoassay lab, we may have about 18 to 25 samples that we have to deal with in a day. And in the clinic, in a week, we run metabolic clinic weekly. We see about 8 to 12 patients daily, weekly, and that's because they have to.
What has been the most valuable lesson you have learned so far in your career?
One of the most valuable lessons I've learned is customer care, so customer service. You ensure that our customers are satisfied at all times and will always want to come back to get our services. I have come to understand that it's important that our customers are happy and that our patients to receive good attention and improve in their clinical state and live better lifestyles and are happier. So I've come to learn that it's very important to ensure that our patients receive the best and they are happy.
Okay, so your future goals from here?
My future goals, and I would like to maybe further my career in toxicology, immunology, and also do some little business side hustle, which I do already.